World Sepsis Day is held on September 13 every year and is an opportunity for people worldwide to unite in the fight against sepsis. You are invited to join the campaign to help raise awareness and understanding of this urgent problem and spark the changes needed to tackle this global problem. Sepsis is one of the most common, least recognized illnesses in both the developed and developing world. Globally, 20 to 30 million patients are estimated to be afflicted every year, with over 6 million cases of neonatal and early childhood sepsis and over 100,000 cases of maternal sepsis. Overall, sepsis accounts for at least 8 million deaths worldwide annually. That means a person dies from sepsis every few seconds. So, what is sepsis and why should we focus our attention on it? Sepsis is the leading cause of death from infection around the world, despite advances in modern medicine like vaccines, antibiotics, and acute care. Sepsis accounts for at least 8 million deaths worldwide annually. Yet, depending on country and education, sepsis is known only between 7 and 50% of the people. Likewise, it is poorly known that sepsis can be prevented by vaccination and clean care, and that early recognition and treatment reduces sepsis mortality by 50%. This lack of knowledge makes sepsis the #1 preventable cause of death worldwide. World Sepsis Day is an opportunity to show support and solidarity with the millions of people who lost their loved ones, or, as sepsis survivors, suffer from long-term consequences of sepsis. Also, it is a great opportunity to remind the public, media, national and international healthcare authorities, healthcare providers, and healthcare workers, policy makers, and the governments that there is an urgent need to increase and improve education on the facility, regional, national, and international level. This is because everyone needs to recognize that sepsis is a life-threatening condition that occurs when the body's response to an infection damages its own tissues and organs. Instead of local inflammation resulting from a local infection, which would be the appropriate response, the body's entire system goes into inflammation. That's sepsis. This inflammatory response can lead to dehydration and a fall in blood pressure. This can compromise the ability of the circulatory system to provide adequate oxygen etc. to the tissues. That leads to dysfunction in various organs, such as the lung, heart, kidney, and brain. Sepsis can also lead to shock, multiple organ failure, and death, especially if it is not recognized early and treated promptly. Therefore, sepsis is a life-threatening emergency.